We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
While the COVID-19 pandemic posed a significant challenge to the world and to Africa, it also presented an opportunity to rethink, shift, and reset. Prior to the COVID-19 pandemic, the prevalence of acute diarrhea in Hara, Ethiopia, was alarmingly high, putting the lives of millions of children at risk. In the face of COVID-19, Ethiopia took the initiative to implement improved practices focusing on water, sanitation, and hygiene. These measures not only helped control the spread of the virus, but had an unexpected positive ripple effect on overall hygiene standards in communities across the country. By harnessing a multi-dimensional strategy that incorporated public health interventions, bolstered healthcare capacity, and forged innovative partnerships, the incidence of acute diarrhea in Ethiopia witnessed an astounding 14% decline by January 2022. And one of these visionary partnerships was quietly working to change the healthcare landscape of the continent.
We formed a partnership with the Africa CDC, and it is based on 4 pillars. First, to purchase vaccines for 65 million people. Second, to roll out vaccinations across the continent to millions and millions more. Third, to lay the groundwork to build that workforce for vaccine manufacturing on the continent. And fourth, importantly, to invest and strengthen the Africa CDC.
The Saving Lives and Livelihoods initiative, set up to urgently procure COVID-19 vaccines and ensure their prompt distribution to millions across Africa.
The Save Life and Livelihood supported African people to avoid the consequence of COVID. And we know that Africa was well protected. We thank colleagues from Mastercard Foundation for their support, but also to build the resilient system we are talking about.
The initiative was also dedicated to empowering healthcare institutions, rapidly expanding vaccine administration with the ambitious target of achieving 70% coverage and establishing local vaccine manufacturing capabilities within the continent. This bold $1.5 billion partnership was focused on saving lives and safeguarding livelihoods in Africa. Recognizing that a well-trained, motivated health workforce is the cornerstone of an effective healthcare system, the program launched comprehensive training programs. From aspiring nurses and doctors to laboratory technicians and community health workers, these future healthcare heroes were equipped with the knowledge and skills they needed to make a difference. By mid-2023, over 37,000 health workers were trained and deployed, significantly boosting the capacity to deliver healthcare at a local level. As the initiative unfolded, the impact was visible in hospitals, clinics, and remote rural communities.
Our countries initially didn't have this Africa CDC bringing them together, but we are getting there because we have strong support from our head of state, from our member state ministers and others.
The program's impact spread across at least 25 countries, and Africa CDC's capacity was fortified, including the integration of over 106 new staff, bolstering the continent's ability to respond effectively to other health crises.
There can be no global health security without regional health security. Public health is fundamentally tied to resilient economies.
The Africa CDC, through the Saving Lives and Livelihoods initiative, empowered the health workforce, leading to a significant enhancement of primary healthcare systems. This bolstering of the primary workforce has been instrumental in early detection and treatment of preventable diseases such as acute diarrhea observed in Hara, Ethiopia, and other regions.